works together, and there's different types of joints that are out there. Basically, um, anytime two bones meet, that's an articulation or it's a joint. How those structures are basically meeting determines on what kind of joint it is and what kind of movement is allowed between those. Um, so the shoulder joint and the knee joint have actually more movement allowed from that. So it allows more motions, allows twisting that, so it has less stability that can be a problem on there. Where a suture is a type of a joint in the skull, that's completely fused. There's no movement, so those are very stable. So we'll talk about those different type of articulations that are out there. And then based on the anatomy, whether it's a fibrous type of joint, cartilaginous, synovial fluid in there, those are all going to justify basically how we're at. So we'll start off with fibrous and cartilaginous joints and talk about those. And those basically are preventing movement in there. Whereas we get a synovial joint means that there's cartilage, two ends, there's fluid that's into that joint, allows a lot of motion in there. And those are going to be, again, lots of motion, but they're at least they're more unstable, if you will, more susceptible to type of injuries. And when they are injured, they take longer to heal. So lots of different joints that we're going to see out there. And I just want you to be aware of those. So again, they are classified by basically their function and motion. So again, synarthrosis, amphiarthrosis, and diarthrosis, I'm not going to have you guys need those. I want you to know a movable joint, and examples of those are going to be sutures in the skull. So those are completely interlocked. Again, as we're infants and such, they are going to be allowed to move. But then once we, sorry about that, but once we get those areas completely fused, it's going to basically be one area, even though those sutures is a type of a joint. And then gomphosis in the mouth, I'm not going to have you guys be responsible for those. So that's going to be basically our synarthrosis is one of our immobile joints, whereas our other articulations are going to be freely movable joints. They're going to allow movement, and again, how the bones are meeting is going to determine on how and what type of motion it's going to be allowed. So let's get into these type of different joints in there. Other aspects of the joint is we're going to have a joint capsule and ligaments, which are going to hold things out. So knee is going to be a good one that defines this. We have our ligaments that basically hold the femur to the tibia and prevent that, like your MCL, ACL, PCL ligaments are going to hold that joint in place. And then you're going to have a capsule that's going to be outside, also has ligaments sometimes on the outside of the capsule, and an articular fluid on the inside. Allows that area to move. Other things that are going to be around are going to be bursa. These are small packets. They're sometimes just connective tissue. Sometimes they have synovial fluid in them. Sometimes they can be for cushioning aspects. Sometimes they're just going to be a rotation area. But bursa are usually fluid-filled sacs that build around areas that help with cushioning and motion around those areas. Other type of areas with synovial, we can have gliding type motions, angular motions, rotation, and other special motions. So that's what we're going to kind of go over. As far as our gliding, these are two opposing surfaces that glide back each other. They allow movement in a specific direction. And this basically, an example is the tarsals and the carpal bones. You can get motion on your hand. Those bones just kind of slide around and they allow the motion up and down, a little side-to-side motion on there. Other areas are angular motion. And this is basically so we can move things at angles and areas. So that allows us flexion and extension, as we see in the humeral, the glenohumeral joint, and down between the humerus and the ulna. Allows adduction and abduction. Shoulder joint allows all of these as well. And circumduction, again, is that motion so it can go around into a circle. Flexion, you guys should know this. We'll talked about in normal anatomy of the positions, but just going over again. Flexion, up towards the body, extension, away or straightening. Hyperextension is going beyond the full extension. Hyperflexion is going to be the same version. So those motions there. Other versions of abduction and adduction, again, in a simple way is add. It adds to the body or it moves towards the body. Abduction is it moves away. So let's look at this. So abduction is moving away from the body. Adduction is adding or moving towards the body. So those are going to be kind of our motions. Circumduction is basically going to be going an ability to move a particular body part into a complete circle. Other motions we can get, again, is that lateral rotation, or moving away from the body and out. Medial rotation is moving in towards the body. Medial aspect if we're coming in. Just kind of depends on how we're dealing with the position. And then we have supination and pronation, which we kind of talked about. Supination is kind of putting the hand out towards that anatomical position, where pronation is rotating it opposite of anatomical position. Again, anatomical position, radius is on the outside with the thumb. Pronation in, or basically turning in, it turns to the inside, and that allows that rotational motion. Other movements, we can have inversion and eversion. Inversion is in, so in towards the body. Eversion is moving the outside away from the body. We can also have, specifically to the foot, dorsiflexion and plantar flexion. Dorsiflexion, again, moving up and towards the body. Plantar flexion, moving towards the plantar aspect and moving away. This is what we call the dorsal surface, the plantar surface when we're dealing with the foot. And these are specific motions to the foot and ankle. These are not specific to the other portion of the body. Other articulations that we have is opposition, movement of the thumb, and this is what we're basically one of the areas with the thumb allowing to have that opposition or moving towards each other. So another articulation that can go. Other articulations that we have is basically retraction and protraction, pushing our jaw in and out, moving that plane straight across, and then basically opening, elevation, and depression. So other aspects that we have, moving that jaw around, we can move inferior and superior, again, all anatomical motions. So different type of joints that we have out there are gliding joints, our hinge joints, our pivot joints, our ellipsoidal joints, saddle joint, and a ball and socket. So let's talk about each quickly, because you will have to kind of know what those are. So gliding joint, basically it allows some motion on here, and I'm going to give you a good example. Gliding joint is the clavicle with the manubrium. It's able to glide side to side, kind of up and down. I also referred to this one earlier as far as the carpal and the tarsal joints are also gliding type joints. When we look at hinge joints, our main hinge joint is basically, I talked about, is the ulna. So here's the ulna here. This portion right here is called the what? I talked about it earlier. The olecranon process. And you can see if we get downward motion or an upward motion into here, you can see why this can be fractured really easy of the force coming down right through this spot, and this being the humerus. So this basically allows that up and down. Not a lot of side-to-side motion on this with the ulna, but up and down, which would be our flexion and our extension. When we're talking about pivot joints, so again, I talked about this in a previous lecture. This process right here, if you remember that, the dentoid and the dens ligament allows our atlas to rotate on our axis. Again, C1, C2, those are important ones to know. Might see those in written format sometime. Other type of synovial or ellipsoid joints, especially where the radius and the ulna attach to the hamite and the scaphoid bones. Again, you just need to know these as the carpal bones. But this is also an ellipsoid. You can see it's elliptical type of a joint and allows for different rotation and motions in a lot of different angles in there. Saddle joints, this is again where the metacarsal meets onto the bone, and it basically is like sitting on a saddle, and it rotates in a specific area. The thumb is the big area there where it rotates on the trapezium. And that able just to rotate, and that allows that opposition motion we just talked about. Other type of ones are synovial ball and socket. So this is considered a ball and socket on the acromion process, the glenoid fossa,